Just the one thing that nobody prepares you for, you always hear the saying, nurses eat their young. You're not having a conversation with somebody else, like somebody's like just above you looking down at you and they just feel superior to you. It's on all of us to change that. It's on all of us now coming in to change that mentality that nurses eat their young. We should be here to support each other and then support the patients that we're trying to take care of.
Joseph, can you go ahead and introduce yourself and where you are along your journey right now?
So my name is Joseph Flores, and currently right now I'm a second semester nursing student. I'm in my very long journey to become a physician. And right now, I actually decided to do nursing first just because I thought it'd give me a good foundation level and just to get my foot in the door of medicine and, start making connections with people.
What inspired you to start this journey? Because you work at Best Buy, so it's kind of a huge shift.
Yeah, I've been with Best Buy almost 10 years now. This year in 2026 will actually be my 8th year anniversary with Best Buy. I would say really what got me transitioning is there wasn't actually like a one thing. It was ever since I was a kid, I had that, that dream, right? Like I was sitting in my second grade class. They handed out this little sheet that was like, hey, what's your name? What do you want to be when you grow up? You know, how many brothers and sisters do you have? Things like that, right? And I sat there looking at that question of what do I want to be when I grow up? I thought of like superheroes in movies and TV shows, right? And I was like, they're always saving the day. They're always the one that like people go to rely on for everything. Even though I was a kid, I kind of knew superheroes weren't real. And I was like, okay, like what's something realistic? And I don't know. I just thought like I thought of doctor, it's kind of like one of those things that you see as a kid, you see also like, you kind of see like superheroes, you see doctors, police officers, firefighters, like astronauts, you see all of them kind of like the same thing. Life happened. I got derailed from that. I'm 29 years old now. And, like I said, I'm in my second semester of nursing. After all these years, I finally got back to that core dream of wanting to go into medicine and, do that to help people and be there for people. And honestly, I'm glad life happened the way it did. Like I've learned a lot. I've gained a lot of experience, professionally, personally. I've got to meet a lot of cool people and I've learned so much from them. And using everything that I've learned up until this point, I feel that I'm at a really good, position to move forward into medicine now and just take all of that experience with me.
And it kind of reminds me of an experience that I had. I was talking to a family friend of mine, and this was when I was trying to decide which occupation I wanted to do. And for many of us, that's kind of a difficult decision to make because it takes a lot of commitment.
Oh, yeah.
And so I asked him, I was like, hey, I'm interested in doing this and that, but I just really want to help people. And he responds with, well, you don't have to be a nurse to help people. You can work at a gas station and help people.
That's true.
And I was like, man, he brought up a good point. So I really thought more into it. And as you know, I've explained this in other interviews, but I have a family history of people who struggle with illnesses. And so naturally, taking care of people in a medical sense has been a part of my life.
Okay.
And so that's why nursing was kind of a perfect route for me to invest my time in. Kind of curious to know, as a brand new nursing student, I mean, not brand new because you're in your second semester now, what does your day-to-day schedule look like?
It's kind of like all over the place. So,
and that's not just you. I think every nursing student,
yeah,
their schedule is all over the place. So
I know, just like a quick tidbit about like other people in my class. I know some of them, are raising families. Some of them are taking care of their families. Maybe it's like younger family members, older family members. They're working part-time jobs, full-time jobs, like all while going to school, so kudos to everybody in my class that's doing what they're doing. Like me personally, I will say first semester, I was a lot more, regimented and structured about, okay, I'm going to go to all my lectures. I'm going to study from this time to this time, do this, do that. Like I had kind of like everything set up and very like strictly regimented. And that was during the week. And then on the weekends I would work and, I would do like 8-hour shifts on the weekend. So it's like, 16 hours between Saturday, Sunday, plus all my time, like all the hours I put in Monday through Friday for school. This semester has been a change of pace. One of the things definitely is, advice to everybody out there going from your first semester into your next semester of nursing. You kind of like the training wheels get thrown off and you're just like thrown in the deep end of the pool, because I feel like there wasn't as much support. I ended up not showing up to a few lectures, and then that kind of just continued. And out of my school, our lectures are optional. You don't have to attend. It doesn't. There's no negative or positive to attend. Aside from like, sure, you're gonna pick up more from the professor teaching. I felt like I was struggling personally to learn while being in the class, so I opted for just not going to the lectures and then studying in my own time. So, what that turned into was the same time that I would be in class for lecture, I dedicated to, okay, I was going to be in lecture for 4 hours from this time to this time. I'm going to do the same thing that we do in lecture where we go 50 minutes on and then a 10-minute break and then 50 minutes on, like a 10-minute break. So I did the same thing, but at home. And like, it was awesome. I got to sit in the comfort of my own room, sit at my computer, just have music playing the whole time and have like a little timer set up and going. So I felt a lot more comfortable in my own space. And I was able to just kind of move through things at my own pace. And like, as I understood something, okay, cool, like let's move on to the next thing.
I know myself included, it took me a while to figure out what was the best study method for me. And I found a lot of value in studying with other people.
Okay.
I wouldn't say have a massive group, because then you just get distracted.
Start
but
talking and talking.
Maybe having one or two extra people to sit down with and really crunch on the content that you are going over during that week.
Yeah.
And that's helped a ton, because each of us kind of scored the same in a lot of our testing. And so we were able to relate a lot in how we understand things and how we internalize some of the subjects and topics. Yeah. And it was super helpful to have people that you can use as a backboard to explain certain things, because you're going to be doing that on the floor with your patients. Obviously not from a doctor's perspective, but you do have to have some knowledge of what medications you're giving to your patient. So being a second semester student already, what has been some of the most difficult things that you've encountered?
I would say the most difficult is the fact that first semester going into second, the training rules come off. First semester, there's definitely a lot more hand-holding where you kind of get nudged along. Hey guys, remember to do this, remember to do that. It felt almost as if they were trying to say without explicitly saying it that, hey, you have to show up for lecture. It felt that way. And, between that and like feeling pressure to go to lecture and having like the hand-holding, like it made it somewhat easier because there's a lot of reminders for stuff. Going into second semester now, it's just like the training wheels come off. It's like your classmates against the world pretty much, Like me and my class, we have a GroupMe set up. So there's like all 40 of us in there, and people are constantly like throwing in Quizlets, throwing in practice tests, throwing in like lecture review stuff, YouTube videos to watch. People are like, oh, hey guys, remember, like we have this thing due today. And it's great because like there's a lot of us, myself, I struggle like super bad ADHD. A lot of times I'll just forget something or it'll skip my mind and I'm focused on like doing something else. And then it comes back and I'm like, oh, I had that thing that I was supposed to do today,
I know for my class, we had a Discord group chat, so it's kind of like GroupMe.
I recommended that,
but it's
not everybody's young and hip.
Yeah, it's definitely helpful to have that within your class.
Yeah.
Because I think we had pretty much everybody on our Discord group chat, and it was very helpful because, like you said, a lot of people will throw in reminders, and sometimes people will communicate there to kind of get together with other students and study. But what has been some tools that you've used to kind of get through some of those difficult things that you've experienced thus far?
I honestly would say the biggest thing is, whatever it is you're struggling with, like ask somebody for help. Like at the end of the day, just ask somebody for help, whether that's one of your classmates, whether that's your best friend, your boyfriend, your girlfriend, your mom, dad, sister, brother, cousin, aunt, uncle, whoever it is. Like ask somebody for help. I'm I'm big on, like, a lot of times in my life when I'm struggling to go through something,
Mhm.
I won't ask for help. I'm just like, oh, I got this. I'll take care of it myself. And that's just a completely wrong way to go about it. Two of my classmates, I talk to them a ton, and they they helped me get through a lot of stuff that I was going through, especially this semester. Like there was a time just recently, like a few weeks back or maybe a month ago, that I was really going through it mentally, and I was kind of just checked out of everything, and I wasn't doing great in class for a little bit. Like work performance was suffering, just life in general. Like I wasn't eating it right. I was skipping the gym,
Mm.
and they kind of like helped pull me out of it. Like just talking to them, and one of them especially was just like, hey, like we're gonna sit down and we're gonna talk.
So you would say going into nursing school, make sure you have an emotional support system set up.
Yep. Mhm. I would say anybody who works, obviously your classmates are gonna be a little bit better at being that emotional support group,
Mhm.
just because you guys are going through the same thing. It's kind of like people that have been in the military. They always have like they have like their war buddies, and it's kind of the same thing almost. Like
Yeah.
you're almost like going to like this metaphorical war, and all of your classmates are like your war buddies, and over time, like you'll gain some like really great friends, and maybe even
It's
some
very true.
lifelong best friends through school. And those are the people that are going to really help you and just like help lift you up, and you guys will do that for each other.
Yeah, I will say some of my closest friends right now are people that I studied with through nursing school.
Yeah,
And
that's
I,
awesome.
I still hang out with them today. I'm even working with some of them on my unit right now. So
That's
it's
that sounds so
awesome.
fun.
Like you said, they're like war buddies. If you could give advice to a new student starting tomorrow, what would it be?
Like the typical educational advice, like obviously like there's YouTube videos you could start watching now. There's
Do you have
different
any like recommendations on what YouTube channels
um
that they could look up?
I mean, for a lot of like nursing related stuff, you have like registered nurse RN Sarah, you've got Simple Nursing, I believe it's Nexus Nursing. There's a lot of other channels as well, but those are kind of like some of the main ones that
Hmm.
like pop up. Level Up RN, those are all like the main ones that kind of pop up over and over again, and they have a lot of good content. I mean, some of them even have like flashcards and like other resources that you can buy from them. So definitely like some good stuff there if you're somebody that wants to watch YouTube. Obviously, like you've got your textbook. Like I know it sucks and a lot of people hate reading, but if you read with the intent to like understand what it's talking about versus just reading because your teacher was like, hey, here's the pages to read, and you read just to like get that check mark, and
Hmm.
say you read it, doesn't help you there. But like if you read to understand it, it fully it truly helps you. um Aside from that, like if you got a friend, a family member you can just ramble to, just tell them all about how the heart works, the lungs work, like whatever it is. Like if, hey, if you had this illness, like here's what I would use, here's what I would check for, here's what I would use, like here's the medications I would be giving you and why, and what things to look out for, stuff like that really helps. The biggest piece of advice is just like know your why, like know why you want to go into medicine, know why you want to get into nursing, and just kind of like leave your biases at the door. There's a lot that I've got to learn and experience, and a lot of things aren't always like what they seem to be when you look from the outside.
So tell me the true reality of nursing school.
I would say the true reality that nobody kind of really prepares you for is there's just, to use one of my classmates' words, because she says it all the time, nursing is a very catty profession,
Hmm.
and it leads to a lot of like clicks and like attitude and just being mean to be mean, and we hear this common theme even from our instructors, like, oh, well, the nurses eat their young, that's a common thing that you hear. And it's not something that I was really prepared for ahead of time. Like I had never heard that saying before until starting at school, because then now I'm kind of on like, nurse talk, and like, on Instagram, I get a bunch of like nursing and like medicine reels and stuff like that. So, and like YouTube shorts. So now that I start to see more of that content, I'm also seeing the same thing echoed online from others. Other first semester, second semester, third semesters are like, yeah, a lot of people in nursing school are just mean, including like instructors. And some of them even say that that's in the name of like, oh, better preparing you to be a nurse because nurses eat their young. I feel like that shouldn't even be a thing, and I tell all my classmates and like anybody going into it, that like it, I feel like it's on all of us to get rid of that narrative that nurses eat their young and be there to support each other and then to support the patients that we're trying to take care of.
That's a very interesting topic that you bring up, because I've had many conversations with other people, and it blows my mind that we're working in a setting of taking care of other people, but sometimes our worst enemies are the people we're working alongside. And it's not the patient. It's not to say that nursing is a bad profession, because I absolutely love what I do.
Yeah.
I love taking care of people. I love taking care of patients. And it really is a great profession. I mean, I only work 3 days out of the week, and the rest of the week I have off.
That's
I mean,
awesome.
what other profession gives you that flexibility?
Yeah. A friend of mine actually is traveling like neonatal ICU nurse. So, I mean, I see her all the time on Instagram. She gets to like just travel the whole world pretty much. I'm thinking emergency medicine right now, like getting into the ER and stuff like that. But who knows? Like you said, there's so many different paths you can take with nursing. I might end up doing something else and just completely falling in love with that.
Is there anything that you would like to share for maybe a nursing student? Maybe it's somebody that's looking into getting into nursing school. What last bit of thoughts you might have for them?
There's only so much preparation you can do. And that's not even just nursing school, but just life in general. No matter what it is that you're trying to accomplish, there's only so much preparation you can do, and that's okay. Don't think that you have to have everything perfect. You have to know all these different things, or you have to have read this book or that book or done this or had this job. Like, nursing is for all walks of life. Just start.